Morning, let's talk about today vitamins. So, do you take any regular vitamins which your GP or doctor hasn't asked you to take, but you still buy it from Sainsbury's or Holland and Barrett's and take it because you think if it is good for health, why shouldn't I take it? Now, if you go to the supplement shop, it is dizzying because there are so many things you can and cannot take. It is unthinkable. Let me give you an example. Spirulina, apparently superfood. Should I take it or should I not? One second. Whatever I take or not take, I have to take this. This is my anti-fatigue drink because caffeine molecule blocks adenosine receptors, and adenosine is your fatigue molecules. So it stops fatigue appearing. So that's why it can be dangerous, because fatigue sometimes is your brain telling you shut down, stop working, I'm getting superheated. That's why you shouldn't be taking caffeine towards the end of the day, when it can in fact disturb your sleep, but you can take in the beginning of the day to delay the onset of fatigue. Does it make sense? So inside the brain there's a lot of heat, a lot of ATP molecules are being broken to adenosine triphosphate to diphosphate to simple adenosine, and that adenosine, when they build up, gives your brain the signal that I have used up so much energy, I think it is time I just chill, like white space, do nothing. So that adenosine is the fatigue molecule, and this caffeine molecule, it exactly looks like adenosine molecule, and it blocks all those adenosine receptors without triggering the signal to the brain that I'm fatigued. So do not take coffee to wake up, because coffee cannot do that. Coffee delays fatigue. So you might think that you're awake and you just need to drink the coffee to wake up, and that's just a placebo. You're thinking coffee is making you awake. Coffee doesn't. Coffee is a stimulant. So in that sense, maybe you can say, yeah, caffeine increases my heart rate, etc. But coffee's main job is to delay fatigue, not to wake you up. If you want to wake up, there are other strategies. And if you want to, if you're interested, just comment on the comment box. I want to know. Now, coming back to, there's lots of surveys in healthy people that do they take vitamins. Now, the more advanced countries, developed nations, interestingly, majority of healthy people who are aware about health needs, etc., will take vitamins, even if their GPs or doctors won't tell. But is it good or bad? If you want to know, comment on the comment box. I will send you a link of a very interesting lecture by a professor who studies vitamins and supplements. But anyway, one thing is kind of common amongst popular knowledge, that omega-3 fish oil is brain protective and good for general health, antioxidant. And vitamin D is definitely protective for particularly dark skinned people living in a cloudy country like UK, like me and my family. So this too is a must. Now, I have been advised to take magnesium, zinc and vitamin B12. So I'm taking this by dermatologist because of angular cheilitis. Since I recovered from COVID, every 2 months, 3 months, I'm having this I'm losing my fingerprints and toe prints, and some funny dryness in the angle of mouth, despite my diet being super nutritious and I'm taking all these medicines. So I don't think it is actually deficiency of this, but magnesium is another very important, interesting molecule, super molecule sometimes they call, very important for cardiac health. And there is a lecture from a cardiologist in York, forgot the name, about how we are going through an epidemic of magnesium deficiency. Zinc is very important for skin health. So whenever there's a skin problem, I see there is a tendency for the dermatologist to say that you're zinc deficient. But I think we need to have more robust evidence to measure up zinc level and magnesium level. The problem is that what is happening in the tissue level, in the cellular level, might not reflect in the blood level. So my blood zinc and magnesium may be normal, but that doesn't mean my tissue level is also normal. And we see this very often in liver cirrhosis patient, decompensated, their sodium level is low, But if you take the whole body sodium, that's super high. So you shouldn't be giving sodium to these patients. So we need to do a lot of work, particularly the other superfood like spirulina. Should I give it to everybody? So we humans as a nature are very deductive. So we want to find out which one is the best one, like, like a we want to know the maximum return on investment, ROI. So should I take this, or should I take this, or if I have to take three, or not all this, which three? So there's a debate is still on. But this is my 7 days mix of vitamins, and I have added a vitamin E, antioxidant, and some multivitamins and vitamin C. Now, do you know the danger of taking too much vitamin? Hypervitaminosis. That's the real danger, because fat soluble vitamin like vitamin A, D, E, K, if you take too much than your body needs, recommended daily allowance RDA, you will accumulate and it can cause toxicity. We know this for vitamin A, etc. And the talk I was talking about, the professor was telling that interestingly, there are more incidents of side effects and events, adverse events, in people who are taking more vitamins than they need. And the explanation he was proposing might be not confirmed, that we are thinking that all the metabolism produces free oxygen radical, which is damaging, denatures cells, damages DNA, makes mutant DNA. So if we get rid of all the antioxidant, that's good, isn't it? So that means take omega-3, take vitamin A, take phytochemicals, kill all the antioxidants, kill all the oxidative radicals, free radicals, damaging free radicals in the body. But unfortunately, body uses the exactly same free radicals to kill bugs. So if you take away body's ability to kill bugs by removing all the oxidative free radicals, by giving a lot of antioxidant, can you see what's the problem? So it's a fine balance. So don't overdo this. Go by your GP advice. But the problem is, we, GP, hospital doctors, we are not in a position to advise you properly. That's a sad fact. So I would encourage to focus more on this as your source of vitamins, colorful stuff, But if you're really deficient, take it. But I strongly recommend, if you're Asian or a dark skin color, take vitamin D, omega-3, maybe some salmon, etc. But that's it. It's just not a guidance. It's a thought-provoking video, just to think about it, ask around, see what's happening, who is doing what. But as I said, the surveys of active, healthy people, entrepreneurs, startup owners, they all take vitamins. Now, whether they take vitamins as a result they are super smart, or they're super smart, that's why they're taking vitamin without evidence or with evidence, this is a big debate. Anyway, have a great day.